mainstream primary or secondary setting, it would be rare that you'll need to pick up, carry or manoeuvre a child. However, in an EYFS, SEND or ALN setting, you're likely to be doing this regularly. So how can you do this in the safest way possible? Hi everyone, I'm Natalie from My Progression, and this video is going to take you through the do's and the don'ts of manual handling in an EYFS, SEND or ALN setting. Now this training will give you some really helpful do's and don'ts that will keep both you and the children safe. Anyone working in a setting where they're likely to have to lift regularly should seek out some in-person training, and we'll give you some details of courses at the end of the video. In a nursery setting, you'll be required to pick up, carry and comfort young children. It's important that you understand the safest way to do this. The EYFS requires all providers to have written policies and procedures, including a manual handling policy. This will outline the safe practices all staff members must follow when lifting and carrying children, ensuring proper posture, weight distribution and minimising risks of injury to both the child and the caregiver. These guidelines will align with the EYFS safeguarding and welfare requirements, which emphasise the importance of children's safety and well-being. Now, each setting will have their own individual manual handling policy, and every staff member must read it and be familiar with it. But there is some general advice on how to carry children safely for both the staff member and the child. A survey of early years and primary education professionals found that 88% suffered back pain. So it's really important to take into account the weight of some of the children you're working with. Some children in early years can weigh up to 20 kilograms, which is over 3 stone. And factor in that they may be wriggling about, it can really put a strain on you. When manually handling children, it's essential to follow safe practices to prevent injury to both the child and the caregiver. So here are the do's and don'ts of manual handling when working with children. Do's. Assess the situation first. Consider the child's weight, mobility, and any special needs before lifting. Use good posture. Keep your back straight, bend your knees, and lift with your legs, not your back. Ask for help if needed. If the child is too heavy or uncooperative, get assistance. Encourage the child to help. If they're capable, ask them to assist with standing or repositioning. Keep the child close to your body. Holding them close reduces strain on your back. Use equipment when available. Use hoist, slings, or adapted furniture for children with mobility challenges. Communicate clearly. Tell the child what you're about to do to reassure them. Now for more on this, check out our video on respectful caregiving linked in the description below. Ensure a safe environment. Remove obstacles and use non-slip surfaces when handling a child. Now some don'ts. Don't twist while lifting. Always turn your whole body rather than twisting your spine. Don't lift with a rounded back. This can lead to injury. Keep your back straight. Don't rush. Sudden movements can cause strain or startle the child. Don't lift above shoulder height. Avoid lifting children too high, as this puts pressure on your spine. Don't ignore signs of discomfort. If you feel pain, stop and ask for help. Don't force movement. If the child resists, pause and try a different approach or seek assistance. Don't hold the child improperly. Avoid lifting under the arms only, as this can be uncomfortable or unsafe. And finally, don't overestimate your strength. If a child is too heavy, use a team lift or equipment. Now, if you're finding this video helpful, don't forget to hit that like button. It helps more people learn safe and effective manual handling techniques for children. And if you want more expert tips, make sure to subscribe and turn on notifications so you never miss an update. Let's make caregiving safer and easier together. Now for SEND. When manually handling children with special educational needs and disabilities and additional learning needs, extra care and consideration are required to ensure their safety and well-being, as well as your own. So here are some specific do's and don'ts tailored for SEND and ALN settings. Do's. Complete a risk assessment. Always assess the child's needs, mobility and associated risks before lifting or moving them. Use individual handling plans. Follow the child's manual handling care plan, if available, to ensure safe and consistent support. Use appropriate equipment. Utilise hoists, slings, transfer boards, or standing aids where necessary to reduce strain and promote independence. Encourage independence. Support the child in participating as much as possible using prompts, verbal guidance, and assistive devices. Adopt proper lifting techniques. As with EYFS, bend your knees, keep your back straight, and hold the child close to your body while lifting. Communicate clearly. Explain each movement beforehand using simple language, visual aids, or sign language if needed. Be aware of sensory needs. Some children may have heightened sensitivity to touch, making handling distressing. Approach them as directed in their plan. Work in pairs if needed. If a child is heavy or difficult to manoeuvre, always seek help from a colleague. Ensure a safe environment. Again, as with EYFS, keep floors clear, use non-slip mats, and adjust furniture or space to facilitate easier movement. And receive proper training. Staff should be trained in specialist manual handling techniques tailored to children with physical disabilities or complex needs. Now for the don'ts. Don't lift a child without a plan. Always follow their care plan or seek advice before moving them. There may be extenuating circumstances where you don't have access to their plan, and in these situations, do an immediate risk assessment and make sure what you're doing is in the best interest of the child. Don't ignore the child's reactions. If they show discomfort, distress, or pain, stop immediately and reassess the approach. Don't use inappropriate lifting methods. Avoid lifting under the arms, dragging, or lifting unsupported, as this can cause injury. Don't overlook postural support needs. Many SEND children require specific positioning aids to prevent discomfort or injury. Don't rely solely on strength. Always use proper equipment rather than trying to lift a child who's too heavy or difficult to move manually. Don't rush the process. Allow time for the child to prepare and adjust before moving them. Don't assume one size fits all. Every child has a unique mobility, sensory, and medical need, requiring personalised handling strategies. Don't ignore staff fatigue. Lifting and handling can be physically demanding. Rotate tasks to prevent strain or injury. Don't disregard dignity and privacy. Always be mindful of the child's comfort, modesty, and emotional needs when assisting with personal care or transfers. And finally, don't skip training updates. Handling techniques and equipment evolve. Keep up to date with moving and handling training for SEND professionals. There are many different training courses that you could go on to teach you the correct way to manoeuvre a child and physically restrain a child if needed. These courses are available in various formats and locations. CPI Safety Interventions has a variety of courses for educational professionals, including how to safely recognise and respond to everyday crisis situations, including safe disengagements and restrictive interventions. And for staff that support people who demonstrate dangerous or complex behaviour, the programme teaches safe and advanced disengagement skills. We've linked some recommended courses below. Remember, all settings will have written policies and procedures, including a manual handling policy. So make sure you read and understand this policy before lifting and carrying. And if you're not sure, then just ask someone in that setting for help. I've been Natalie from My Progression, and let's keep your career in motion.